More than 20 million Americans now have health insurance thanks to the Affordable Care Act, or Obamacare.
However, many are nervous about the incoming Trump administration's pledge to repeal and replace the bill.
9 on your side's Tom McKee is live now.
Well, Carol, depending on who you ask, this is either help people or hurt them. On the plus side, of course, subsidies for lower income citizens and guaranteed insurability for those with pre-existing conditions. But on the negative side, there have been reports of course, higher premiums and deductibles and lessened number of doctors and networks to choose from. And this has all set the stage for potential reform.
Missy and Mandy Spears launched a new business last week called Keep Your Shirt On, Covington. The Affordable Care Act helped make it happen. Mandy has a rare form of muscular dystrophy requiring specialized doctors' care.
So in order to get to see them, the insurance has to cover it. And a lot of times the insurance wouldn't cover it before.
It was really difficult. We had to jump from job to job in order to stay insured.
Obamacare's subsidized coverage freed up funds for their shop.
I can get to those specialists, and it's also paid for some surgeries and other complicated procedures that I really needed.
It's a big relief. It's really helped out, especially during a rough time.
Ennis Tate left corporate America for the ministry in 2008, but his family of 6 lost health insurance and his church couldn't pay for a full-time pastor.
I was without insurance for 2 years.
The Tates changed that narrative by finding ACA coverage.
Without care, life would be very rough for us.
As president of Inland Marine Services, Dave Hammond has a different perspective. The Hebron firm has 700 employees across the country, transporting coal, oil, and grain on inland waterways. The ACA required health insurance for all of them, which wasn't cheap.
We're paying $12,000 per person. Now we're paying $18,000 for that same type of coverage.
Annual employee contributions rose from $3,000 to $5,000, with deductibles doubling or tripling, a trend Hammond says can't continue.
We're optimistic that there will be there'll be a repeal and a replacement of ACA Obamacare.
John McConaughey is with the Greater Cincinnati Association of Health Underwriters, the folks who match people with health coverage.
I can tell you that if we don't do something in the next year or two, that this plan, the Obamacare plan, is going to fold under its own weight.
For those without subsidies, premiums and deductibles have skyrocketed. At the same time, the number of network providers has decreased and prescription costs have soared.
So we need something that's going to be more inclusive of the providers and reduce costs in the drugs.
Hammond agrees the system needs to be retooled.
The more competition there is, that it will drive costs down and give us more abilities for each person individually and the company.
And while the debate rages, those with ACA coverage wait, wonder, and worry about possible life without it.
We would definitely be heavily in debt for every time I have to go to the doctor.
We just don't want to go back to having to be uninsured or to see an increase in our premiums where we just can't afford to live.
Now, I will tell you this, that none of the people that I spoke with to prepare this story was convinced that there's going to be a total repeal without any sort of replacement. They say that would be, in many cases, political suicide for the new administration. Back to you, Carol, Craig.